Okay, hello everyone, and we are going to get started. Thank you so much for joining us today. We are going to be talking about the implications of unregulated cosmetic personal care products on women's health. Just some housekeeping before we actually get into the conversation. As a reminder, the last 15 minutes will be reserved for questions throughout the webinar. A question and answer feature will be at the bottom of the screen, so you can take a look, take a minute to take a look. And so throughout the webinar, if you have any questions, just feel free to write them down. So we have a few takeaways that we would like for the participants to have after this webinar and just throughout the webinar. So for one, we would like to have an honest conversation about the toxic ingredients in cosmetic and personal care products that are specifically marketed to women and have a direct, negative, and disproportionate impact on women of color and for women. So the purpose of this webinar is to highlight the advocacy work that our organization and some of your organizations are involved in to combat this issue. Specifically to bring together our material and intellectual resources so we can put a dent on this very important conversation that is affecting women. So we'd like to have a platform that we can continue this conversation, to share best practices and develop innovating practices and methods to make sure this issue is combated. So just some background information. On any given day, the average woman uses 12 products containing 168 unique chemicals every single day. And so the average man uses 6 products daily with 85 unique ingredients. Some of these ingredients have been linked to health problems, including cancer and infertility. So for example, from soaps to toothpaste to shampoos, and even makeup. So just going off of some of those examples, we know that brands targeting, many of you know that brands targeting children are almost always brightly colored and sweetened. So they would have ingredients like red 30, blue 33, blue 1, yellow 5. Colgate, for example, has been selling Colgate Total for nearly 2 decades with the ingredient triclosan. That ingredient has been linked to hormone disruption and even breast cancer. We know that lipsticks have been found to contain lead, a neurotoxin that can be very dangerous even at small doses. Hair products have been shown to release potentially dangerous levels of formaldehyde, which is a known carcinogen. So just to continue, so we know hundreds of chemicals have been discovered in cosmetic and personal care products. So more ingredients include phthalates, mercury, parabens, endocrine disrupting hormones, and more. So taken all together, all of these chemicals have a deleterious impact on women's health. But just to show you more specifically, just to go more in depth on how dangerous some of these products are, take, for example, disrupting hormones. Endocrine disrupting hormones have been linked to fibroids, endometriosis, obesity, reproductive issues, neurological conditions, and even premature death. And we know that with fibroids and other hormonal issues, Black women have higher rates. And so if we know that these products have been known to be harmful, what is the source of the problem? Who do we need to, or where do we need to go to tighten the loose area of this conversation? Well, one way is federal regulation. So the Food and Drug Administration, also known as the FDA, is the federal agency that is in charge of regulating cosmetic products. However, under the Food, Drug, and Cosmetic Act, as many of you know, cosmetic regulation has not been updated since 1938. And so currently companies can put just about anything in their products. So who is joining us today to discuss this issue further? First, we will have Janet Nudelman, who is the Director of Programs and Public Policy at Breast Cancer Prevention Partners. Then we have Scott Faber, who is the Senior Vice President of Government Affairs with the Environmental Working Group. We also have Janet Robinson Flint, I will call her Jan, who is the Executive Director for Black Women for Wellness. And then lastly, we will have Ivanna Yang, the Director of Advocacy for Beautycounter. So Janet Nudelman, who is the Director of Programs and Public Policy at Breast Cancer Prevention Partners, has over 30 years of experience working in this sector. She's been working in the social change and the arena as a political organizer and lobbyist on women's health issues to create and oversee BCPP's cutting edge work. So under her leadership, BCPP's advocacy efforts are playing a very important role in making breast cancer prevention a priority in state houses and the halls of Congress, and have resulted into the passage of some of the nation's most important environmental health legislation. She coordinates BCPP's 15-year-old campaign for safe cosmetics, which has exponentially raised consumer awareness and demand for cosmetics and sparked the growth of a $15 billion safe cosmetic industry. So Scott Faber, who is the Senior Vice President for Government Affairs at the Environmental Working Group. Prior to joining EWG, he led efforts to modernize food safety law for the Grocery Manufacturers Association and led campaign for the Environmental Defense Fund. Scott frequently testifies before Congress on food, farm, energy, water, chemical policy issues. So Scott received his JD from Georgetown University Law Center, where he is also an adjunct professor. So Ms. Jan Robinson Flint is as I mentioned, the Executive Director for Black Women for Wellness. Her work in the health field began as an advocate during her pregnancy, seeking a holistic practitioner to work on the concept of a gentle birth. So Jan's journey has included the Birthing Project, USA, Great Beginnings for Black Babies, the National Health Foundation, March of Dimes, California Primary Care Association, Inglewood Healthy Mothers and Babies, South Los Angeles Health Project, and Women and Infant Children programs. So currently, she is a member of several reproductive justice organizations in California and nationally. Ivanna Yang, Director of Advocacy for Beautycounter. She previously represented trade associations in Washington, D.C., advocating for consumer protection and access to the civil justice system. Ivanna received her JD from George Washington University School of Law and a bachelor's degree from Washington University in St. Louis. So we're going to start with going further into the cosmetic safety and legislative landscape. Janet will discuss the work and research BCPP has done on the issue and provide an overview of the federal cosmetic safety legislative landscape. So you can take it away, Janet.
Well, thank you so much, Isabelle, and the National Women's Health Network. As Isabelle said, I'm here today speaking on behalf of Breast Cancer Prevention Partners. We are formerly the Breast Cancer Fund. We're the only national organization sitting at the nexus of women's health, environmental health, and breast cancer prevention, focused solely on preventing the disease by eliminating the environmental links to breast cancer. Next slide, please. I'm also representing our campaign for safe cosmetics, a 15-year-old campaign that is protecting the health of consumers, workers, and the environment through public education and engagement, corporate accountability and sustainability campaigns, and legislative advocacy, all designed to eliminate chemicals linked to harm to human health and the environment from the cosmetics and personal care products we use daily. Next slide. Since the Campaign for Safe Cosmetics was launched in 2004, we've helped to move the cosmetics industry towards safer products and practices and stronger ingredient disclosure, convincing OPI nail polish to remove 3 extremely toxic chemicals known as the toxic trio from their nail products in 2006, and Johnson & Johnson to globally reformulate their baby and adult products in 2011. We've driven 2 particularly bad phthalates, dibutyl phthalate and DEHP from cosmetics, triclosan, and many parabens from the big multinationals' cosmetic products. And we've convinced Unilever, Procter & Gamble, and Johnson & Johnson to disclose the secret fragrance ingredients in their products. These are just a few of our hard-fought victories. Next slide, please. But our end game has always been stricter federal oversight and regulation of the largely self-regulated $84 billion cosmetics industry and the $70 billion self-regulated fragrance industry. For over a decade, the Campaign for Safe Cosmetics has been working to secure passage of meaningful, health-protective federal legislation to give the FDA the statutory authority it needs to ensure cosmetics and personal care products are safe for people and the planet. Next slide, please. Ironically, we are now finding ourselves in a be careful what you wish for situation, with some members of Congress from both sides of the aisle and both houses authoring and advocating for federal cosmetic safety policy reform that does little to change the 80-year industry self-regulation of cosmetic safety, while giving the big multinational giants the cover they need to address the growing lack of consumer confidence in the safety of their products and the federal preemption they want of the state's ability to legislate on cosmetic safety. For a long time, the action was in the House of Representatives, where Representative Jan Schakowsky, a Democrat from Illinois, and her then House colleagues, Senators Tammy Baldwin and Ed Markey, were actively championing comprehensive federal cosmetic safety reform, with the introduction of their Safe Cosmetics Act in 2009, 2011, 2013, and most recently, again in 2018. Their bill sets a high bar for cosmetic safety, putting consumer and worker health first, and demanding cosmetic companies take responsibility for their supply chains and be accountable to the FDA and to the public for the full disclosure and the safety of their ingredients and their products. Representatives Dingell, Pallone, Lance, and Sessions worked their way into the conversation with the introduction of 3 different cosmetic safety bills in the House in 2012. But things stayed quiet in the Senate. That is until 2015, when Senators Dianne Feinstein and Susan Collins introduced the Personal Care Product Safety Act, which they have then since reintroduced in 2017 and 19. Over the past 3 years, the legislative landscape has changed even more dramatically as more and more cooks have entered into the cosmetic safety kitchen. Next slide, please. In October 2017, recently retired Republican leader Senator Orrin Hatch from Utah introduced his own cosmetic safety bill, a 10-page bill which took only a small bite at the problem. And then toward the end of that same year, a bipartisan Senate Health Committee cosmetic safety discussion draft emerged, created by pulling from bills introduced by Senator Hatch and Senator Feinstein, but further weakened by low expectations of what the Republican majority would be willing to stomach. Not surprisingly, no one liked this bill from either side of the aisle, and it was never introduced. But it did demonstrate the interest of Health Committee Chair Lamar Alexander in the safe cosmetics issue. Next slide. Since the introduction of the first Feinstein-Collins bill in 2015, the Campaign for Safe Cosmetics has taken a support if amended position, working hard to convince the author and the Senate Health Committee to strengthen the bill to make it more consumer-facing, more protective of workers, while also working to influence the introduction of a stronger companion bill in the House being drafted by Representative Pallone. When or if Senator Feinstein's bill moves forward in the legislative process, we think common sense amendments are needed to strengthen the bill's safety standard to ensure that vulnerable populations like children, pregnant women, women of color, workers, and other highly exposed populations are protected. Make industry self-certification of cosmetic safety more robust, require the full disclosure of fragrance, flavors, and other ingredients to the FDA, manufacturers, and consumers, require industry data sharing of safety studies to assist small companies and decrease animal testing, and also allow the states to legislate on cosmetic safety by removing the federal preemption provisions in the bill. Next slide, please. We consider a new bill that will be introduced on September 9th by Representative Jan Schakowsky to be the gold standard for cosmetic safety. Representative Schakowsky's bill would ban chemicals linked to cancer and birth defects from retail and professional salon products and fund research into safer alternatives to toxic chemicals negatively impacting workers and communities of color. Her Safe Cosmetics and Personal Care Products of 2019 is the only federal cosmetic safety legislation calling for supply chain transparency and full fragrance ingredient disclosure to consumers, workers, and the FDA. And it's the only piece of federal cosmetic safety legislation with an environmental justice plank specifically designed to address the overexposure of women of color to toxic chemicals in the beauty and personal care products specifically marketed to them. Next slide, please. So why is fragrance disclosure so important? The majority of the beauty and personal care products that we use smell good because they contain fragrance chemicals. And recent product testing conducted by the Breast Cancer Prevention Partners and our Campaign for Safe Cosmetics revealed just how toxic hidden fragrance ingredients are. Last year, we released a report called Right to Know, Exposing Toxic Fragrance Chemicals in Beauty, Personal Care, and Cleaning Products. Our report tested 140 cleaning products and personal care products for volatile organic compounds and 32 personal care products and cleaning products for hidden fragrance ingredients that do not have to, by law, appear on product labels. Our most shocking finding was that the majority of the toxic chemicals we found in the products we tested were fragrance ingredients, hidden from public view. Next slide, please. This is a list of the top 10 products our product testing showed to be most toxic. A mix of celebrity-endorsed perfumes, a body lotion, a couple of shampoos, and a couple of cleaning products. Next slide, please. Out of the 25 personal care products and beauty products BCPP tested, the product with the most toxic chemicals was a children's shampoo marketed to kids of color and a hair relaxing kit called Just For Me. This product, made by Strength of Nature, an international hair company, contained 24 chemicals linked to chronic health effects, 71% of which were fragrance chemicals that did not appear on the label. The 17 fragrance chemicals of concern in Just For Me included 1 carcinogen, 6 chemicals linked to reproductive and developmental harm, 1 chemical linked to neurotoxicity, 2 to respiratory harm, and 15 endocrine disrupting compounds, especially troubling for a product marketed to and used by kids whose bodies are especially vulnerable to hormonally active chemicals. Outrageously, this kid shampoo was found to be more toxic even than the tub and tile cleaner we tested and the industrial cleaner and disinfectant. Next slide. Our report's major policy takeaway is that consumers are correct to fear the health consequences of secret fragrance chemicals that don't appear on the label. And we can reduce the number of toxic chemicals consumers are being exposed to by demanding full disclosure of fragrance chemicals and stricter regulation of the self-regulated fragrance industry. You should go back for a sec, Isabelle, thanks. Which segues nicely into Representative Schakowsky's Safe Cosmetics and Personal Care Products Act of 2019. Hers is the only federal cosmetic safety legislation that mandates full fragrance ingredient disclosure across the entire supply chain, which means fragrance disclosure from manufacturers to the FDA, from suppliers to manufacturers, and from manufacturers themselves to consumers. Her bill funds research into the beauty products and chemicals of concern that they contain, marketed to women and girls of color, and public outreach to help impacted communities avoid these toxic exposures. It creates a grants program to support research and design of safer alternatives to toxic chemicals in professional salon products and products marketed to women of color. It bans the use of animal testing on finished cosmetic products and for any ingredient that has a validated non-animal testing alternative. It prohibits confidential business information claims for cosmetic ingredient data related to human health or environmental toxicity, function, fragrance, flavors, colorants, or contaminants in cosmetics. It creates an interagency council on cosmetic safety to share ingredient safety data between the FDA, NIEHS, OSHA, CDC, and EPA, and it protects the rights of the states to legislate on cosmetic safety. Next slide, please. So what's next? Most of you probably know that Representative Pallone, the chair of the Energy and Commerce Committee, is working with Representative Shimkus to draft a companion bill to the Feinstein-Collins bill. Last Congress, we were concerned that his goal was to introduce a nearly identical companion to the Feinstein-Collins bill. The good news is, with the Democratic control of the House, Representative Pallone has promised a stronger, more health-protective bill. But that's where your advocacy needs to come in. Our hope is that Representative Pallone will draw from the Schakowsky bill as his Energy and Commerce Committee addresses cosmetic safety this fall, so as to send a stronger bill over to the Senate, which would then, in the best of all worlds, raise the Feinstein-Collins bill to a higher bar of cosmetic safety as well. Next slide, please. We hope you will join our efforts to secure the most health protective, meaningful cosmetic safety reform bill possible, because the time is now. And we'll make it easy for you, hopefully, to jump on to this issue so that the industry won't be controlling the safe cosmetic conversation. We invite you to join the 50 clean cosmetics companies and nonprofit organizations that have already endorsed the Schakowsky bill, including the National Women's Health Network, Black Women for Wellness, Beautycounter, Coming Clean, We Act for Environmental Justice, the Learning Disabilities Association, Friends of the Earth, Clean Production Action, and the list goes on, by signing on as an organizational endorser. Next slide, please. So please join us and feel free to contact me at any of the places you see on the attached slide. And thank you so much, Isabelle, for the time to address this very esteemed group of colleagues. Oh, Isabelle, you need to unmute yourself.
Yes, Janet, thank you so much. So like Janet mentioned, we really need strong federal regulation around this issue. And the Schakowsky bill is really a bill that can protect us in some ways. Scott is going to be discussing how this really impacts us through a case study. just to highlight how the industry has few to no legal requirements protecting against toxic contamination, Scott will elaborate on the discovery of asbestos and other toxins that have been reported in products as recently as 2017.
Great, thank you, Isabelle, and thanks to the National Women's Health Network. So maybe go to the next slide. I think all of you are probably familiar with the news that that asbestos, which of course causes mesothelioma and other health problems, was once again found in facial powders marketed to teens. This shows just how broken our cosmetics review system is. And unfortunately, cosmetics purchased at stores like Claire's and Justice are not the only products that are likely to contain asbestos. There's always some risk that products produced with talc also contain this dangerous carcinogen. Next slide, please. EWG, using our Skin Deep database, found more than 2,000 cosmetics and other personal care products that contain talc, which including more than 1,000 loose powders or pressed powders that could pose a risk of being inhaled or absorbed. And as I'm sure you all know, even small amounts of asbestos in talc can cause mesothelioma or other diseases many years after exposure. Next slide, please. It's certainly not a secret that talc can contain asbestos. Companies have known about the risks that talc can be contaminated with asbestos since the 1950s. Next slide, please. And reports in the 1960s also found trace amounts of asbestos in talc deposits. And so I'm sure you're wondering why that is. And that's because talc and asbestos can develop in the same parent rock, in the same parts of the earth. So it's extremely difficult to mine the talc that might be used in powders and other personal care products that is not contaminated with asbestos. Next slide, please. In fact, the FDA was first alerted to the presence of asbestos in talc in 1971. That's the memo that you see there on the left. And 3 labs found asbestos in talc between 1972 and 1975. Next slide, please. But under pressure from cosmetics companies, FDA in 1976 allowed the cosmetics industry to police itself and to rely on a testing method that can't guarantee that products made from talc, like baby powders, are free from asbestos. Next slide, please. And this is from the bottom of that FDA memo, which said in so many words that the work that's been proposed by the cosmetics industry, their trade association, which was then called the CTFA, or Cosmetics, Toiletries, and Fragrance Association, does not offer much assurance that cosmetic talcs are adequately tested for asbestos. Nevertheless, FDA signed off on testing procedures that could not indeed guarantee that these products were free from asbestos. Next slide, please. And then when asked to at least require a warning on products, as some countries do, made with talc, the FDA declined to do so. First in 1986, which you see on the right, and again in 2014. Again, this really underscores just how broken the system is. Next slide, please. And so, as I'm sure many of you know, just recently, FDA once again found asbestos in talc in products marketed by Claire's and Justice, and only for the first time said that the presence of asbestos in one of these products makes the product illegal, or in the words of the Food, Drug, and Cosmetic Act, makes the product adulterated. And in the course of making this announcement through a press release, FDA's leaders, Susan Main, who runs the what's called CIFSAN, a part of FDA, and former FDA Commissioner Scott Gottlieb said that current law does not require cosmetics to be reviewed and approved by the FDA prior to being sold to American consumers, as Janet just described. And go to the next slide, please. They further said, and these are their words, not mine, right now when it comes to cosmetics, companies and individuals who market these products in the US hold the responsibility for safety and labeling of their products. This means that ultimately a cosmetic manufacturer can decide if they'd like to test their product for safety. To be clear, there are currently no legal requirements for any cosmetic manufacturer marketing products to American consumers to test their products for safety. Again, really underscoring the need for reform. Next slide, please. And of course, asbestos, as Janet and Isabelle have already said, is not the only contaminant or chemical of concern in personal care products. Since 2009, cosmetics companies have reported to the California Department of Public Health using 88 chemicals linked to cancer, birth defects, or reproductive harm in both men and women. Next slide, please. And as we've heard, FDA is not required to review or regulate any of these chemicals, and indeed has only banned or restricted 9 chemicals for safety reasons. Next slide, please. Meanwhile, more than 40 other nations have banned or restricted more than 1,400 chemicals in cosmetics and other personal care products, including asbestos. So why don't I stop there, Isabelle, and turn it back to you.
Thanks so much, Scott. So yes, again, highlighting how unregulated these products are and how hundreds and thousands of chemicals get into these products or are placed into these products and then affect our health. And really currently there's not much that the government can do about it. And so just to sort of dig deeper and look at who are the vulnerable communities that are affected by this issue. We know that Black women experience one of the highest rates of preterm births, preeclampsia, fibroids, and a host of other maternal health issues. And so Jan will dive into what is causing some of these issues.
Thank you, Isabelle, and thank you all for inviting me to participate with this impactful and insightful conversation. And I'm calling this Overexposed and Unprotected. And if we have been listening to the information that Janet and Scott shared, you know how overexposed and underprotected we are, and particularly as Black women. Next slide. Black women are often exposed to chemicals and beauty products that are linked to early puberty, obesity, and increased breast cancer. And the sad part of it is that we are overexposed from in utero. Next slide, please. This is a little bit about Black Women for Wellness, but I will come back to the work that Black Women for Wellness is engaged in a moment. Next slide. So, one of the challenges why Black women are exposed from in utero until to the tomb is that we are trying to live up to beauty standards of white folks. So the current beauty standards mean that the lighter your skin is, the more European your facial features and your hair texture, the more economic justice you will experience, meaning that when you find folks who are able to get into the great schools or have the fabulous well-paying jobs as Black women, you will see that they are closer to white than to, I'm going to say, our basic Black. So part of what we need to do in terms of our work at Black Women for Wellness is begin to shift that cultural standard so women don't feel that need to use these products that are toxic, carcinogenous, and cancer causing for us. Next slide, please. So the beauty industry is, and we've talked about this too, it is a billion-dollar industry. There's more than $9 billion in the beauty industry. So, and Black women spend the most money on or inside that beauty industry. 80% on the beauty products, and most of it is on our hair. So the beauty industry has gotten very savvy in terms of marketing to Black women. They now are marketing organic products that are not necessarily organic, and natural products that have nothing to do with natural. So next slide, please. And why is this important, or why are they doing this? Black women, as has been mentioned, we suffer more from fibroids. The number that I get coming back at me, that 80% of Black women have some type of uterine fibroids. And the number one treatment until recently for uterine fibroids has been a hysterectomy. So that is a direct impact on our reproductive health or our reproductive lives. I talked about how Black women use these chemicals at an early age. I remember very clearly wanting to use a detangler on my child's hair because I wanted to comb it and I wanted to look cute. So, and that's what we do with our children, because we want them to fit in and be appreciative and build their self-esteem. We also talk about hair dyes, and as the Black women I know have many colors of hair. We have red hair, we have all kinds of different colors of hair, and that's because we also are trying to fit into a society where we will be appreciated for who we are and for the beauty that we share. And I also know that as Black women get older and get their gray hair, they are more likely to dye it, and the dyes that we need are a stronger dye with more pigment, because our hair is strong hair and it doesn't take it unless we put a lot into it. If we're trying to dry our hair lighter, that means that we have to strip our hair of color. If we want to be blonde or platinum, that type of thing, we have to strip our hair. And that's also a more toxic dye that we have to use. And because we're applying it directly to our scalp, it sinks into that body and becomes more a part of the chemical mix that is in our body. So I'm going to move on to the next slide. This goes into the work that we're doing. One of the reasons why that we are involved in this work is Black Women for Wellness. We have a staff of 10 people. Of that 10 people, 3 people have had breast cancer, and that's a lot. One person has had 2 miscarriages, and so it is quite personal to our lives about why we are doing this work. The first place we started doing this work was with our hair care professionals. What we noticed, or what is happening in our neighborhood, is that there are a lot of hair care professionals and they are dealing with breast cancer. So they are starting breast health programs, and they're also helping themselves. So our first initiative was called Behind the Chair, where we began to celebrate the Black hair care professionals and look at the contributions they are making to the health field. The beauty shop is a great place to get health information, and it's also a place where women are overexposed and underprotected. Beauty hair care professionals use beauty products on maybe 8, 9 women a day, whereas your typical client goes in every 2 weeks or once a month. So that beauty professional is very much overexposed to chemicals that are toxic or induce bad health. Next slide, please. So in addition to the Behind the Chair in terms of working with beauty professionals, we also did Curls and Conversations. So there are lots of folks who do hair who are not, quote, hair care professionals, unquote, in the beauty industry. There are a lot of folks who do braiding and twists and other natural hairstyles, and they wanted to know what kind of products could they use, as well as they were also doing or creating products themselves to use with the natural hairstyles that they were using. So we created Curls and Conversations for women who were doing hair, but not necessarily a professional hairstylist, as well as women who wanted to know what type of products they could use on their hair and have a more natural look for their hair, but still get the results that they wanted. Next product, please. I should say before I go there that we created a series of health education materials called Styling Safely. And in that Styling Safely, we looked at 5 different ways to help people reduce their exposure to chemicals. So one was ergonomics in terms of the repetitive motion and how to do some exercises to cut down on the consequences of the repetitive motion. The second one was personal safety equipment, and basically we talked about how to use aprons and goggles and where to put fans and that type of thing, personal protective gear to help reduce your exposure. We also talked about how to read labels, because a lot of times the labels, they do say fragrance, which sounds harmless but can mean so much. So we talked about the different things to look for in labels, and you'll see a chem card come up that every time we print it, it goes out very quickly, because people do want to know what to look for in terms of what to avoid and what is okay, because some chemicals are okay. And then we also talked about obesogens, because Black women are very concerned with our obesity rate and needed a little bit more information about why they might be doing everything well, but still not losing the weight that they want to lose, but not looking at the endocrine disrupting hormones or products that could be found in their bathrooms or in their kitchens. Then one of the challenges that keeps coming back to us is there's no research creating a correlation between the chemicals that are in our products and our health status. So we are in partnership with Occidental College to do a research project called Taking Stock. So taking stock is really a 3-step process where we are asking women, what products are you using and what age you started using those products and why you're using those products. And then the next part of it is we will analyze in terms of the top 20 products that are coming back that women are using to see if it has chemicals that are related to breast cancer in particular, or any other type of illness that pops up from the chemicals that come back from that. Then we'll also be doing biomonitoring with 70 families of the chemicals that are in their bathroom and in their kitchen. So that's the taking stock. And what we're looking at really are beginning to create the research that Black women need and brown women, because this is a study of Black and Latino women, to really determine what products we're using and what's the chemical content or makeup of those products, and is there a correlation with our health. Next slide. So, and I talked a little bit about obesogens. What this slide is really looking at, and we actually got it from our work with breast cancer prevention partners, is that there are a lot of elements or a lot of conditions that lead to or could lead to not only obesity, but to cancer. There's the environment, there's our culture. In our culture, when we have a fat baby, that's a good thing, right? So is it that or the food that we eat that's full of fat? Sometimes I joke about, you know, if I want to eliminate the peach cobbler from the family reunion, I might get eliminated before the peach cobbler. We talk about our access to green space. In our neighborhoods, there are less and less green spaces. In Leimert Park, where our office is, they actually put a fence around the only park. We talk about drugs and medication, and when are those drugs introduced to us and what type of drugs are introduced to us. I'm talking about legal drugs in this situation, access to healthy foods, sexism and misogyny and racism and the stress that goes with that and how it impacts your immune system, toxic chemicals, personal behavior, disease, in terms of some of the, when we go back to drugs, some of the diseases that that we have, which are chronic, from diabetes to high blood pressure to heart disease, etc., introduce toxic drugs to us and further impact our health and well-being. Next slide. So we talked about Just For Me, and the only thing I could to add to what Janet had to say about Just For Me is that when they did the study, what we found is that Just For Me is put in the stores on the shelf in those very brightly colored boxes and marketed very well at children's eye level. So you have a very attractive child in brightly colored boxes at the eye level of children, not necessarily at the eye level of adults. So you have they're creating a demand in children for this. So, and this is also what I mean just in terms of how we're exposed in utero also, because our parents or our moms are putting products on their hair, and it could pass the placenta and it might not, but the exposure comes lifelong, because if we're talking children as young as 2 and 3 are being exposed to these shampoos and relaxers, etc. Next slide. And the other thing that we notice is that Black women statistically get breast cancer at a younger age, and sadly and unfortunately, we're now getting breast cancer more and much more likely to die from breast cancer than other women. So Black Women for Wellness has teamed with Silent Spring Institute, where we were looking at the EDCs, the endocrine disrupting hormones associated in our hair products. We tested 18 products that are used by Black women and found that most of them had these products. Most of them have fragrance. 84% of the chemicals detected are not on the label, and relaxers are marketed to young Black girls had the highest levels of 5 band-regulated chemicals. And remember, when we're talking young Black girls, we're talking girls as young as 2 or 3 years old who are exposed to these chemicals. And the younger and more frequent the exposure is, the more likely that their health is compromised. Next slide. So what can we do? And this is actually my favorite slide. First, we have to do a cultural shift. And last, we have to do a cultural shift. As long as Black women are trying to live up to European beauty standards, they will always be using toxic chemicals. So how do we create beauty standards that are based on healthy and are based on a woman looking her best or shining her best in her natural state? So that's where we have to go with that. Better policy. I appreciate what Janet talked about in terms of national policy, but there's also state policy. Some of the issues that we have been trying to recognize that California are SB 574, which just actually died, and that simply asks for this disclosure in terms of, we want to know the chemicals that are in the products that we're using. If we test products and 84% of the chemicals that are in that product are not listed on the labels, then we know we have an issue, and we still have that issue. But I have to remind myself on a regular basis that this is a $9 billion industry, and we know that we need to develop stronger policies, but stronger representatives and officials who will listen to constituents as opposed to beauty industry money. Because right now we have the fox that is guarding the hen house. We are training not only beauty professionals, but looking at beauty schools and those type of entities, so people will have more information on how to recognize chemicals and the impact that chemicals are having on their health and well-being, as well as inside in the beauty shop, that type of thing. So we're also increasing education and awareness, elected official accountability we talked about, and we are also doing the research. Next slide. that's the chemical card that I talked about that we have, that we are putting in a business side card so people can take that into the stores with them. Next. And I talked about 574 and how it died, so I can just move on from that slide. Thank you.
Thank you so much, Jan. As Jan mentioned, Black Women for Wellness have been doing a lot of research and great work on just uncovering how these products are affecting our health. And so I really look forward to the research for the project Taking Stock that you mentioned. And so now we're going to shift the conversation, because at this point we have covered, you know, the fact that these products are not regulated. We've covered how they affect our health. We've covered the numerous chemicals that are in the products. And so one of the things that we can do to combat this issue, well, industry can do, is to actually use safe ingredients and properly label their products. And so as Jan mentioned, and Scott and Janet mentioned, we know that the cosmetic market, the beauty industry, is valued at billions of dollars. And so in light of the success, they're still failing us. And so we want to shift to what industries are actually doing the work to provide safe products for us. And so Ivanna Yang is the Director of Advocacy for Beautycounter. She's going to discuss what industry can do to make a positive change, and how Beautycounter is involved in advocacy at both the state and federal level, and their efforts in producing safe consumer products. So take it away, Ivanna.
Thanks so much, Isabelle, and thanks for the National Women's Health Network for the opportunity to be a part of this webinar. So hi everyone, my name is Ivanna Yang, and I'm the Director of Advocacy at Beautycounter. We were founded 6 years ago by our CEO, Greg Renfrew, when she couldn't find products on the market that were both safer and higher performing. So being a serial entrepreneur, she decided to start this company herself. And from day one, our number one priority has been safety. And along with that, we want to make sure that everyone has access to safer personal care products, which is why advocacy has been a key part of our business model as well. So we achieve both goals through our rigorous formulation process, as well as advocating for more health protective personal care product laws. Next slide. So as many of you know, the US lags far behind other countries in both Canada and the EU in the number of ingredients that FDA restricts or has reviewed. So the US restricts just 30 ingredients compared to over 600 restricted in Canada and over 1,400 ingredients restricted in the EU. So what are we doing about this? So Beautycounter is proud to lead the industry with our Never List, which is a list of over 1,500 ingredients that we promise never to formulate with. And while we're proud of our Never List, we think what really sets this list apart is the ingredient selection process that we go through when we screen every potential ingredient that we're looking to use in our formulations. So we screen each ingredient against our 23 health and safety endpoints. These are things like whether the ingredient causes allergic reactions, whether it's carcinogenic, whether it causes hormone disruption, and even whether it affects marine wildlife. So for example, when you wash your hair with shampoo and conditioner, that runoff here in California runs directly into the ocean. So we want to make sure that all of our residue from our personal care products do not have harmful effects to marine wildlife. So our best-in-class screening process has been validated by the Environmental Working Group, by the Chemical Footprint Project, as well as by our certification as a B Corporation. Next slide, please. So advocacy, as I mentioned, is one of the pillars upon which Beautycounter was founded, and it's woven into our business model. So Beautycounter is a direct retailer, which means that we go directly to where the consumer is. And our largest sales channel is our network of over 40,000 independent consultants across North America. Next slide. So many of our consultants come to the company because of their passion to make a difference through advocacy. You know, we hear from a lot of consultants that they learned about Beautycounter once they were cleaning up their diet and what was in their medicine cabinets. And of course, they want to make sure that not just for themselves, but for their friends, families, and for their entire communities, that when you go into a drugstore or department store, that you're rest assured that those products are going to be safe for you. And unfortunately, right now, that's just not the case. So they are very passionate advocates, and we find opportunities for them throughout the year to make their voices heard. Next slide, please. For example, every single year, we arrange for our consultants district meetings, and these are meetings that they have with their members of Congress and staff back in their home districts. So last year, we held over 250 meetings across North America with over 1,000 consultants, and we do this every spring. And then every other year, we bring about 100 consultants with us to DC to advocate for their members of Congress in person. In 2018, we brought 100 consultants with us to DC, and we held over 100 meetings in just one day, asking the members of Congress to support personal care product safety laws. And we'll be back in DC in spring 2020, where hopefully we anticipate advocating for a comprehensive cosmetic reform bill in the House. Over the years, Beautycounter has also hosted congressional briefings in DC. Just this past year, we held a briefing with 3 leading health experts on the endocrine disruptive effects of certain ingredients in personal care products. Our CEO, Greg, also frequently speaks with lawmakers about the need for better regulations and the importance of clean beauty companies like us in moving the industry forward. Next slide, please. We also try to engage the public and outside of our consultants. We have a very popular text action that's been used by over 150,000 people to send emails to the members of Congress. And that's just texting the word Better Beauty, all one word, to 52886. And once you text that, you'll receive a link to enter in your address, and it'll send an email directly to a member of Congress asking them to support better beauty laws. Our store in New York City also has a phone booth which has the numbers of every single senator in the US, and we provide a script for you to call in and just ask your senator to support the current Senate legislation, the Personal Care Product Safety Act. We also have postcards in the stores as well that you can fill out, and the store associates will send directly to your member of Congress. So over the past few years, we've really seen the momentum and awareness of better beauty legislation just dramatically increase. And we've also seen significant legislation requiring the removal of harmful ingredients in personal care products, such as children's products and salon products and sunscreens, pass in states like Oregon, California, and Hawaii. And as mentioned earlier, we expect federal action in the form of comprehensive cosmetic reform legislation to be introduced this fall. So Beautycounter has been a part of all of these efforts because as part of the fastest growing segment of the $70 billion cosmetics industry, the cleaner, safer beauty companies, we believe that businesses are a vital voice in moving regulations forward that protect public health. Because ultimately we believe that beauty shouldn't just look good or give you pleasure, but it should also give you peace of mind and earn your trust and your loyalty. Because we believe that ultimately beauty should be good for you. Thanks.
Thank you so much, Ivanna. And so as she mentioned, Beautycounter is involved in some really innovative advocacy work, and I'm really excited about it. One of the things that I think we can do as consumers, and I know some of you already know this, or many of you do, is we can start demanding for safer products And so just to bring this all together, as I mentioned before, the purpose of this webinar is to highlight the advocacy work that our organization and some of your organizations are involved in to combat this issue, and specifically to bring together our material and intellectual resources so we can put a very important dent on this very important conversation. And so we have shared the information that many of you know and some of you may not know about the dangers of ingredients in these products. We've shared how Congress has lagged on this issue, and also provided you with some of the information that our organizations are involved in. And so feel free to come onto our website at the National Women's Health Network, or any of the following, any of the panelists' websites. I'm sure there will be a lot more information that we have to share. And so we're just going to take these last 10 minutes or so to answer questions. You can use the Q&A feature at the very bottom of the screen. I see that some of you have already started using the chat function. I see that one person asked about, they're looking at a hand cream called All the Good Stuff and None of the Bad Stuff. And they're also looking at pH balanced, hypoallergenic, and non-comedogenic products. And they're asking if they should feel safe. I know the product is from Naked Bee, and so I know, Scott, you had sent them a link. And so you can check out EWG's website. EWG has a database where they have a list of products that are considered safe and have been tested.
Isabelle.
Yes.
Yeah. So in addition to EWG's website, the Campaign for Safe Cosmetics also, I believe, has a website where you can put in a product and have a score come back regarding their product. We're also working on an app called Detox Me, and we're doing that in partnership with Silent Spring, where we are asking, well, you can put your product in or scan the barcode on it, and we'll send you back email, not email, but the app will tell you the rating on that product. So that app is called Detox Me. So there are a lot more applications in terms of apps that you can put on your phone and websites now that let folks know where or how toxic or non-toxic that their product really is. However, I do want to say, I think this is something that we should not try to shop our way out of, because it creates the affordability challenge, meaning that those people who have incomes that can afford a higher priced product or have transportation to a different neighborhood where they sell those higher priced products will be okay. And those of us who are left in low income communities or who don't have the economic means will still be getting toxic products. So yes, if you can, shop your way out of this challenge, but know that we need a different solution, so it's not incumbent upon the consumer to solve the problem, right? So that's why I actually applaud Breast Cancer Prevention Partners for the work they're doing at a federal level, for the work that some of us are doing at the state level, and for the research institutions that we are in partnership with, because we need to figure out how to solve the problem, not simply at an individual level, but at a cultural and societal level also.
Yeah, thank you for that comment, Jan. We definitely don't want to just shop our way out of this issue. Currently, we have limited options, but someone did ask, what is the best way to get involved in helping pass this legislation?
I could jump in. And thank you, Jan, for the shout out to our organization and the work we've done together. Black Women for Wellness and BCPP and Women's Voices for the Earth and Beautycounter are reeling just a little bit right now because we've been working on a bill in California for the last year that would have forced the disclosure of the toxic fragrance and flavor ingredients in beauty and personal care products sold in our state. And it's a bill that would have benefited everyone because as the 5th largest economy in the world, of course, the cosmetic products sold here in California are sold in all 50 states. But the bill was just held in the Assembly Appropriations Committee. So we're working very hard over this next week to try to convince the speaker, Anthony Rendon, the Speaker of the Assembly, to unstick the bill and resurrect it. So if you want to help with that effort, you can either go to the Facebook page of, I'm trying to think, maybe you can help me, Ivanna, where we can send them. We're directing tweets to Speaker Rendon, Anthony Rendon, asking him to resurrect the bill. And what I'm going to do is I'm going to ask my colleague, Catherine, to just text me what his Twitter handle is, and then we can share it with all of you on the webinar. But in the meantime, in terms of federal legislation, the best thing that you can do right now is formally endorse Representative Schakowsky's bill. Because like I said, we consider her bill to be the gold standard for cosmetic safety, and we want Representative Pallone to pull her environmental justice plank, her worker safety provisions, her fragrance disclosure provisions into the bill that he's currently constructing, and will move to the Energy and Commerce Committee for their consideration probably this fall. So by showing there's broad-based support for Representative Schakowsky's bill, her more progressive elements stand a better chance of being morphed into the Pallone bill that moves through the committee itself. So if folks are interested in learning more, they can contact me at janet@bcpp.org, and I can send you the link to the sign-on for the bill. And it looks like I might have just gotten, yes. So Speaker Rendon's Twitter handle is @Rendon, RENDON 63rd. So 63RD. And if you could tweet him and say, please protect our right to know the secret fragrance chemicals hiding in our products by letting SB 574 come to the assembly floor for a vote, we would much appreciate it. And check out our Facebook page, Safe Cosmetics. It's let's see, Camping for Safe Cosmetics.
You sort of went out there, but in addition to the Twitter handle, we also have the number for Speaker Rendon's office, which is 916-319-2063. And we can ask him to move the safer fragrance bill to the floor. And so we're going to wrap up now, but we have time for one more question. And so we have a question from Roline Milford. I hope I said that correctly. The question is, what would you recommend as a first step towards doing an assessment of the products in my home to see what I have that may or may not be harmful to my health and well-being?
Okay. Well, I will take a stab at it first, and then I'm going to throw it to the rest of the panelists. But basically, we have a card, I think that you can find it on our website, which is bwwla.org, and it's called a Chem card, and it has a list of toxic chemicals. So what you can do is either A, get your products out and read your products and see what ingredients are in them, and then compare them to the list to see if your products have toxic or non-toxic chemicals in them. So that's one of the things you can do. You can also scan that product to the app, Detox Me, or you can also look that product up on EWG's website, Skin Deep, I think it is, and Scott can update me on that, and see where your product rates in that regard. So once you know where your product stands, then you know if you can go, ooh, okay, I'm good, or you can go, okay, I need some new products. And then that's where you start in terms of looking if we're going to shop our way out of this by reducing your own exposures. Then we also talked about personal protective gear. So if you're using products, like for instance, if you're using cleaning products, then are you using an apron so they don't get on you? Are you using gloves? Are you using eye goggles? Do you have great ventilation when you're using those cleaning products so that the fragrance or the airborne toxins are not being absorbed by you, or you're trying to cut down that as much as possible? So those are places to start in terms of in your personal life. Black Women's Wellness has two research projects going on right now. One is taking stock, and if you look back through the slides, you'll see takingstockstudy.org, where you can take our survey, or you can also go to our website once again and take our Behind the Chair survey. So those are two surveys or research projects that you can take part in. We love volunteers. And a lot of times folks bring by products. And I would say that Beautycounter has been wonderful in sharing products with us, so that if you're a volunteer at our organization, sometimes you get exposure to some products that you might try that won't cost you until you start purchasing the product yourself. So those are some ways that it can that you can start in your personal life in cutting down on your exposure to chemicals.
Yeah, so if anybody else would like to add to that, and then we can wrap up. I want to be respectful of everyone's time.
Hey, Scott, do you want to mention your cleaning products database? Because I think that's a good place people can go as well.
Oh, thanks, Janet. Yeah, so we, in addition to having a guide to Cosmetic, Skin Deep, and there are many other great tools out there, we also have a guide to cleaning products. We have a guide to sunscreens. We actually have a guide to food, processed foods, that rates foods based on, in part on the chemicals that are added to the food. So there are a number of great tools on our website. You can also download our Healthy Living app, which combines all of those scoring tools into one app. So you take out your phone, go to the store, scan the barcode, it will give you a score and tell you whether you are choosing a product that has has chemicals that pose fewer risks, or chemicals that pose more risks. So they're great tools.
I'll just re-mention our two websites, bcpp.org and safecosmetics.org. And those are both places where you can go to find tip cards for safer cleaning products, food packaging, as well as cosmetic products.
And then just one last thing from me, if you go to beautycounter.com, you can find a short version of our Never list, which has some of the top ingredients that you should look out for when you're purchasing personal care products. And as Jen and others have mentioned, fragrance is one of the big culprits, because it could encompass hundreds of ingredients. So I would definitely advise people to watch out for that term and try to steer clear of personal care products that have the word fragrance or perfume on their labels.
Thank you. Thank you so much for joining us today, and thank you to our wonderful expert panelists. and we look forward to doing the work, advocating, and continuing this conversation and sharing our resources. And so this webinar will be posted online, and feel free to visit any of our websites to find more information and resources. Thank you all.
Thank you.
Thank you.